Okay. All right. So yes, I'm going to be talking today about my work on developing and testing digital mental health solutions with community partners. So both just to begin with, I'll go through a little bit of my background. Sorry, I'm getting my screen to work here. So inspired by my little brother, pictured here on the left, who is on the autism spectrum, I first started my career doing behavioral therapy with children with autism in homes and schools around Melbourne. After this, I started my PhD in psychological science at La Trobe University, and this really laid the foundation for knowledge about research, and in particular, where I began to develop my independent research, which at the time was focused on understanding stress and emotion regulation in children with autism. I was awarded a Vesky Victoria Government Award, which then supported my international training on physiological recording and analysis, which I then applied to my research. And during this project, I learned valuable skills about science and how to conduct research, but I was really eager to make more of a direct impact on the community in clinical practice. So I accepted an offer to do a postdoc at the Penn Center for Mental Health, where I am now. I transitioned to faculty a few years ago, and that's at the University of Pennsylvania in Philadelphia. The focus of that postdoc was on clinical service design and implementation science, and that was in the context of preschool and school-based autism interventions. My center is really a leading hub in terms of implementation science in the US, and I was able to work across lots of federally funded projects focusing on implementation science. I also started my work as my independent research portfolio on digital mental health, which I will talk more about today. All of these projects I will discuss have their foundation in community partnerships. And I've been very fortunate to have my work funded by the National Institutes of Health, including the mental health section, as well as some industry funding as well. So I'm going to talk to you about 3 projects that are on digital mental health. The first one is the Keep Calm app. That's my baby project, where I got my career development award from the NIH. And that's to reduce challenging behaviors in children with autism. The second one is the Footsteps app, which is an app that we developed to support children's development one step at a time. That's strengthening services in specialized therapeutic support, or one-to-one aids that work with children with autism and other children who have behavioral support needs. And the third one is the Neuroflow app, and we tested that with university students to look at engagement with the mental health application by looking at different incentives, behavioral economics incentives, and financial incentives. Okay, so I will talk about the Keep Calm app first. So this, as I mentioned, is my baby project. I'm the principal investigator on that project. I'm working with a wonderful team of research assistants and a great industry partner called Alivio Systems that's based here in Philly. Okay, so first, just a bit of a rationale as to why we wanted to develop this application in the first place. Why do we think stress detection is important for children with autism? Well, children with autism experience high levels of stress induced by difficulties dealing with a host of factors, changes in routine, sensory overload, social confusion, bullying, sleep difficulties. But sometimes their stress is not easy to detect at low levels. Teachers report that he went from 0 to 100 in 2 seconds flat. But what if we could detect and intervene at lower stress levels? So to intervene to prevent challenging behaviors like aggression or self-injury. Okay, just because you see it doesn't mean it's not there. The idea here is that just because you don't see emotional expressions in a child with autism, that they're not showing it on their face or their body or in their voice, it doesn't mean that they're not experiencing emotions. People with autism have a very rich emotional experience, but they have difficulty communicating those emotions because of their autism. They have a communication disorder. So we found that when children with autism have higher heart rate, so signifying physiological stress, they did not communicate those stresses through their body, through the face, voice, and through face, voice, and body, like their typically developing peers did. So the communication of stress may build up and lead to them expressing that in undesirable ways, like in challenging behavior. This is just some data showing that we found that physiological stress predicts the onset of challenging behavior in children with autism. We did that using an area under the curve analysis. So all of that to say, we've developed an application to detect stress in children with autism. And now, how do we detect stress? We wanted to look at different wearable devices that are on the market. And so we examined about 10 devices in adults, and then we measured those in children with and without autism, and we found a couple of devices that were good for measuring stress in children with autism. They were comfortable, they were valid, as in they did detect stress changing over time, and they were reliable as well. So we use that information from prior work to develop the Keep Calm app. So this is the idea of the Keep Calm app. So let's say Jose, he's in the classroom, he has autism. He's wearing one of these devices that detect stress. We have a chest strap and a wristband, one of them, whichever one is the most comfortable for him. That's connected to an application that the teacher is using, which helps to monitor his stress over time. And then that also helps to tell Ms. Johnson, his teacher, which strategy to use for him for the stress level that he's at. Of course, every child is different, so we'd have different types of strategies being recommended for different students. And the best thing about the Keep Calm app, I think, is that it's individualized per child. So the app learns the pattern of physiological stress reduction, as well as other data that the teachers enter about whether they thought the strategy worked or not, or whether they thought the behaviors were going down over time. And it helps to individualize the suggestions about strategies that they can use with the children. So the app helps teachers detect stress through the wearable heart rate trackers. They can see the strategies that work best for the child, and they can share those strategies across the team. We know that consistency for strategy implementation is really important. So that consistency is it's really a vital part of the app. This is what the app actually looks like. This is Figma designs, but the app now we do have a prototype that's working, that we're testing in the field. So the stress detection portion is here. You can see the stress zone rainbow section here. Can you see my mouse? Yeah, you can. Okay. Yeah, so you can see the child is at moderate stress level or baseline here. The app will not only suggest those strategies that are individualized, but they'll give a pop-up so that they don't have to be in the app while seeing that information. We also have a summary of at the end of the day, detailed one for teachers, noting all the things that happened during the day that they took note of, the behaviors, strategies, triggers that the child had. And then we have also this basic version, which is designed more for parents so that they can also get information about how the child's doing at school. We don't stop there. We also want to pair that with resources that they can use so that they can know what to do with the children. And so we, based on a systematic review of evidence-based strategies for supporting emotion regulation in children with autism, we developed strategy infographics and videos that we have inputted into the app. So that will be in the next testing cycle. We'll be including those. We just got feedback on those from our advisory board. Okay, so we are, as I said, we're wrapping up the rapid cycle prototyping for that app, and we're just about to start a randomized control trial in the next academic year for that app. Okay, another app that I'm working on is the Footsteps app. So the idea here is to help support teams that are working on a one-to-one basis with children with autism and other behavioral health needs in community settings, at home, at school, in the community, to take data on their programs so that they know how the child is going a long time, how their progress is going, whether they need to change the intervention that they're using. So a very related concept, but for this application, it was funded by a parent project that was designed to integrate implementation science. So how do we know what to do in community settings for evidence-based practice, and also with behavioral economics that helps us to understand how to motivate adult behavior change. So, so that is the project. The name is Footsteps. Again, a great team that I'm working with here. We started off with a technology partner called Mosaic, and we are finishing up a pilot randomized control trial with them for a number of technical reasons, including the fact that we need a native app rather than a web-based app. We have chosen another industry partner for a full-scale trial that we'll do next. But yeah, so that's the team. We did a lot of work similar to the Keep Calm app. We did a lot of contextual type of inquiry with the community to begin with, to understand how to improve data collection processes for these one-to-one aids. We established agency partnerships very early on in the project. We ran an innovation tournament, so that's a fancy way to say that we did some crowdsourcing of ideas of how to improve data collection procedures using an application. We did interviews with supervisors, with the frontline workers who work with children with autism and other behavioral support needs, so the one-to-ones and the supervisors. And then we did 3 rounds of rapid cycle prototyping with the app. Now we're running a randomized control trial on that app. So just a bit more on background. So the one-to-ones that are working with the children in the community settings are often given pretty limited training on data collection, not very closely supervised. They're taking data in situations that can be quite emotional when you're dealing with a child with autism that has challenging behaviors that can be quite stressful in the moment. They are socially isolated from their peers because they are working on a one-to-one basis with the child. And they have little incentive in some ways because they're not paid very well. There's high turnover. They are doing a very difficult job with not a lot of support. So the main 2 barriers that we see here, and they have to do this data collection that's very, very difficult. And often they don't have a good system for doing that. So the systems that often they're using are paper and pen, and they don't allow for easy behavior tracking over time or sharing that data across team members. And as I said, they're working in a solitary nature. So it doesn't really allow for a lot of opportunities for timely feedback. So we developed this application with these 2 barriers in mind. So we created a digital interface and application that also has a web portal where they can track the behaviors over time and graph those behaviors. They also get, this is where the behavioral economics part comes in, they get pop-up reminders, they get tailored feedback messages about how they're doing with their job and how much data they took in their last session. There's comparison charts, kind of like leaderboards, to show how they're doing compared to what their agency expects them to do. So a lot of embedded behavioral economics principles to help motivate more engagement with doing a fundamental part of their job, which is to take the data. We are including the EAST framework, which is from behavioral economics, easy, attractive, social, timely. And so the easy part, they're doing it on a digital interface. Social part, they have a sense that their supervisor is listening and caring about what they're doing, and there's that the leaderboard to show how they're doing relative to their peers. We have found through our interviews and through the innovation tournament that people really wanted some good graphing features in the application. So so that was something that we definitely needed to make sure we had in there. And they wanted some timely information as well. So some information about how they're doing in the session. If they've forgotten to take data in a 1-hour interval, then a pop-up reminder to remind them to do that. This is what the app actually looks like, and mapping each of the parts of the app to those EAST principles. So the app allows them to take data based on the child's behavioral plan, which is will have different goals for behaviors that they're wanting to decrease and skills they want to increase. They can take note on when it happened, how long it happened, the intensity of the behavior, the context, any notes. There's the graphing features there that I mentioned. There's a lot of different ways to have their feedback compared to how they did the last week or compared to their peers, with gifts to kind of celebrate their success as well. So they really have that sense of like, yeah, someone cares about what I'm doing. And as I mentioned, the feedback reminders and pop-up messages. And then there's a way for them to connect with their supervisor there as well. Okay, so that's the Footsteps app. Now I'm going to talk to you about the Neuroflow app, which came to me in a different way. It's not something that I created, but it's something that I thought was a good idea and that we wanted to test. So, for this project, I'm the principal investigator, working with a wonderful team. I have a great independent study student, which is basically like an honors student in Australia, and a great technology partner, Neuroflow. So a bit of background on this area. So mental health conditions like anxiety and depression are highly prevalent among uni students and are increasing in frequency and severity. So we know that this has been exacerbated by the COVID-19 pandemic. Research suggests that high emotion regulation difficulties among uni students correlates with high anxiety and depression. And there's been large-scale studies demonstrating low rates of mental health service use relative to the amount of mental health services available, showing that there's something going on there in terms of accessibility or in terms of accessing mental health services. And while there's great promise with digital mental health interventions, most of them have not been studied. Over 95% of digital mental health apps have not actually been studied. So that's what we're wanting to do with this project. I'll just run you through what this app does and what it looks like. So the way that this app works is that you basically screen for either having clinical levels of anxiety or depression, or if you do screen as positive for either one of those, then you go on a track that's relevant for that diagnosis or for that screen. So if you screen positive for anxiety, you go on the anxiety track. If you screen positive for depression, you're on the depression track. If you don't screen positive for either of those, then you go on a well-being track. So it's really based on where the needs that you have. And so once you're in there, there's lots of different trackers. They track the sleep and your mood and things like that. There's rewards that are embedded in. So actually this app does a pretty good job at embedding a lot of the behavioral economics principles I was talking about before in the application. There's also some widgets there to help with relaxation and things like that. So as a part of the behavioral economics sort of framework that they had to develop this application, they put in some gamification. So one main thing that they used is points accrual. So you accrue points once you have completed activities, and those activities can be watching a video that's like a psychoeducation on coping skills or something like that. They also have different, any of those trackers that I showed you before. If you complete those, then you get more points. So more engagement, you get more points. And for in working with this company over the last couple of years and sculpting out a research project that we mutually wanted to investigate, we could see that a part of the app here, they're wanting to understand, is it essential for engagement? So not only do you accrue points, but there's a way here to cash those points in for financial incentives. So you can cash those points in for actual gift cards, for Starbucks cards or Walmart's cards, so cards that are, for popular retailers around the US. And so if you gain a certain amount of points, like for example, if you do all the things you're supposed to do within a month, you'd have enough for a few coffees. So it's not a lot of money, but some incentive. And they wanted to know, is this financial piece of this, is that what is driving more engagement with the app, or is it the other kinds of things that they have in there, the points accrual, they have some other like quotes of the day and things like that, other kind of motivational pieces. So we ran a randomized control trial where we're looking at 2 versions of the app. One of the versions had all the regular behavioral economics principles embedded, and the other one had all of that plus the financial incentives. So we screened 107 people for eligibility. The only inclusion criteria for the study was that they had to have a smartphone and they were university students. So we didn't have anyone that did not meet criteria for the study. We had 54 people allocated to the no gift cards, 53 to the gift cards. And we did lose a lot of the students during the trial that did not do the follow-up assessment. So that's something to consider there. Those that did go through with the follow-up assessment and were included for analysis were the 26 on the no gift cards and 28 on the gift cards. So I'm just going to show you some initial results. We're still looking through that. And then I want to do a bit of reflection as to what we've learned through these 3 projects. So in terms of the completion rate, we did not find that the financial incentives made a difference. The groups engaged with the app to the same rate, and that that did not matter with the financial incentives. Interestingly, we did find some differences, not a treatment effect. We didn't find any treatment effects. So financial incentives also did not matter for mental health and well-being outcomes. But we did find that there was a change in time. There was a time effect for anxiety and emotion regulation difficulties. So anxiety and emotion regulation difficulties went down over time in both of the groups. We did not see any effect on depression, and we did not see any significant effect on well-being. So this app, it didn't matter about the financial incentives, but just using the app, it seemed to help with anxiety and emotion dysregulation, but not so much with depression and well-being. Okay, so just to take a breather here and reflect on all of the projects that I just talked to you about. They were at different points of the life cycle of the development of the app. When I started with them, with the KeepCalm app, we created everything from scratch. We did stakeholder interviews with principals. We did interviews with teachers, with parents. We did design workshops. We built the initial prototype. We're currently doing the randomized control, the rapid cycle prototyping, and we're about to do the randomized control trial. The Footstep app, there was already an existing app out there. We adapted it for our needs, and we did a lot of community work to understand what we wanted to include in that application. So stakeholder interviews and then an innovation tournament that I talked through before. We did agency meetings to co-design this with the community. We built the prototype. We tested it in 3 cycles and in 3 rapid cycle prototyping cycles. And now we've almost finished the randomized control trial. We're about 2/3 of the way through. And with the Neuroflow app, the app was already created. We picked that up after it was already commercially available. We wanted to test it, and we've just finished the randomized control trial. So what did we learn across all of these projects? Well, we learned that really the community partnering aspect is crucially important. This is actually taken from a paper that we wrote a few years ago, which is related to how do you build community partnerships for meaningful research that is going to drive change in communities. And we saw that at every stage of the research project, you really have to really form and maintain the partnership throughout, so that not only do you create something that is going to be meaningful for the community, but you do it in a way that incorporates their needs and their desires, how we can change practice together. And then after the research, making sure that they're involved in the dissemination of the knowledge that you gain through the testing and development of the application, but also help to drum up enthusiasm to have more people want to buy into using the technology. So throughout the partnership, building, maintaining trust is really important, and then respecting the organizational practices and beliefs we found was really important. And that's true of these 3 projects. It's true of many other projects that I've worked on at the center. And much of this is true with the industry partners as well. So really wanting to align on the vision at the beginning, making sure that you have, some joint goals in terms of what you want to get out of the project. And, having that frequent and open communication being really, really important. Here's some more specific learnings that we had about these areas of the pipeline that Chris had mentioned in my intro. So partnering with industry, we realized that it's so important to talk not only with the directors of industry, of companies that do mobile development, but also to talk with the mobile developers themselves, because they really have a good insight as to what is possible, what can we really do. Aligning the vision for the product, as I said from the beginning, making sure that they really understand, what you're trying to do with the technology, not only, the sort of the steps to get there, but what the end goal is. Clarifying communication channels early, making sure that you have a point person or who to go through, so it's really super clear to everybody on the team. Also thinking through the end goal in terms of what kinds of platform you want to use. So what type of code you want to be using. Do you want code that's going to be good for Android and iPhone, for example? What type of app? Do you want a native app? Do you want a web-based app? Do you want a web-based server that's going to connect with the app? Any electronic health record integration, making sure that you have all of that information right from the beginning, so you can make good choices about who to partner with. Conducting community-based needs assessment and contextual inquiry. So what did we learn there? We learned that hiring the right staff to conduct the needs assessment is really important. A good interviewer can really gain more insight into real community needs. So you want to make sure you have people on the team that will, make people that they're talking with feel comfortable enough to open up and really share their true thoughts. Asking the right questions, really making any interview protocol like iterative, and make sure that you're really thinking about whether you're asking the right questions to get the information that you want. Asking the right people, the right groups, making sure the stakeholder groups that you want to be represented in the design of an application are represented in that early contextual work. And going to a setting where the technology is actually going to be used as well. So understanding that in the context, information that really helps to know what the needs are for the technology. Co-designing with community partners. So we learned that getting to know who in the community is the agent of change is really important, because there's no point to create a great application if there's not going to be, buy-in and uptake of using that technology at the end. So finding champions within organizations that will help you to do that. Communicating what is and what is not possible to them. So not over-promising. Obviously don't want to under-promise, but not over-promise too. And clarifying the reasons behind their suggested changes, so that you really can make sure that you're making changes that really speak to their feedback. Implementing rapid cycle prototyping. So we learned definitely setting realistic timelines with industry partners, including the update sprints, making sure that those are all aligned with your timeline as well. Checking in about progress, as it comes, as you progress. Engaging participants in between the testing cycles, making sure that we don't lose them, in between the testing cycles. Raising issues early, being specific about clear update requests, including visuals and very clear ways to communicate that to the tech development team. And celebrating successes together. I think that that is something that we really learned. You know, there can be some frustrations where, you know, you have communicated that you wanted this done and they do something different. And when you get to the point where you're like, you have something that you're really proud of, really celebrating that together, because I think that that's, you know, it's a journey together. You want to make sure that you know, that their progress and the work on the project is being valued and respected. Also leading randomized control trials in community settings. So we learned that doing the partnerships really need to be both top down and also bottom up. So not only the leadership, but the frontline workers too. It doesn't, making real change does not happen only by having leaders on board. You need to have people actually wanting to use the technology and by being bought into, you know, that technology. Making sure you have some good partnerships on recruitment, that's really important. Drumming up enthusiasm, not only for the app, but for the knowledge that's to be gained from the trial. We learned that that is something that's really important in the context of communities just wanting to have that app ready now, you know, and not, you know, not always seeing the value of doing the research and really checking everything along the way. Sometimes they just want to, you know, get to the finish line and have that app available. But I think, you know, really communicating how, you know, this information can really help to better that technology, to improve, you know, our understanding of what will help, that can really make a difference too. So setting the long-term vision for change to help manage those expectations on research timelines. So a lot of learnings across many projects. Next steps for my work is I want to expand my portfolio of work in the digital mental health field. I see many different directions that the KeepCalm app in particular could go in terms of expanding to different populations. So adults with autism or other populations affected by emotional dysregulation like anxiety, depression, and trauma. I'd love to work more in the space of global mental health to improve access to digital to mental health care, and all focusing on improving the implementation and access to mental health through digital innovations. I was really excited to hear about the recently funded projects at the Center for Digital Transformation of Health, and would love to, you know, continue that journey and exploring that together. I have so many things, so many people and so many organizations to thank for all of this work. All the families and all the teachers that were involved in all these projects, the many funders, wonderful collaborators and staff, the industry partners I talked about, community partners. It's a lot of people to thank for this body of work.
Should ask the first question, if that's okay. I think I've got a lot of questions racing through my mind. As I said, there's a lot of content there that was really, really interesting. I think the contrast between some of those different apps is really interesting. In particular, I know that you came on late with the Neuroflow app, but it's quite a different project to, say, you know, the KeepCalm app, which is a very focused project on a particular group of individuals, whereas Neuroflow seems to be trying to, you know, this sort of catch all, and in that process you ask them the questions and then put them down as a streamline. I was just wondering, you can see obviously I can see the pros of that, but about the different experience, particularly in terms of engaging stakeholders. You've got a much broader group of people that you're trying to engage with, or, you know, different problems, different needs. Some of the difficulties with designing and measuring, you know, measuring the response and results with anything like that.
Yeah, so yeah, let's try and unpack with your question there. So we, yeah, there's definitely a different focus on, you know, on the Neuroflow app, where that one is as you said, like a catch-all. It's supposed to be something that that meets the needs of the person, no matter where they fall in terms of the mental health wellness kind of spectrum. And so I think, you know, the challenge for that application is to make it meaningful for each of those different tracks. I was not as involved in terms of the community partnerships. They had done a lot of work in the community before I came on board. But they, those community partnerships obviously would look very different, because they're not only just targeting anxiety, but depression and, and sort of wellness as well. Positive psychology was embedded there too. So, that is different from, having connections with a particular community. I've obviously worked in the autism space, quite a lot, and so have developed, partnerships through that area. But that's not to say that those partnerships can't be developed outside of your area. Definitely, I think the partnerships are foundational. You just need to have them in place. Otherwise, you're developing technology that may not be suitable, for people's needs, and as I said, will not be uptake, at a later stage, and it's not going to be, useful to the community. I'm not sure if I really answered your question, or I'm just sort of talking around the topic.
I suppose it's just, it seems challenging, and I was just keen to hear whether that was the case, and your insights into, how to overcome that when you're trying to sort of, approach such a broad group of people.
Right. I think what's important is to communicate that you care, and that it's something that is important, and that needs to be solved, and to be genuine about that, and to really try to understand where they're coming from. I think I've learned a lot from my mentor, David Mandel. He used to ask community partners, what keeps you up at night? He really wants to know, like, what is the problem that you're trying to solve? I think the struggle with the research and how grant funding works and everything, we need to come up with a problem. We need to have literature to support that. And often we're coming up with the idea, and then we're trying to find the community partners to work with. And I think ideally what works best is to really develop those partnerships that are outside of any one particular research project, and have those be really a reciprocal relationship where you're giving and you're taking on both sides, so those are really in place, first, and then you can understand what is it that they really are trying to solve, and then develop a project that comes out of that. Sometimes of course it doesn't always work that way, but that's an ideal circumstance where you've got a problem that you're solving that that the community really wants to be solved.
That's great.
Can I ask a question, since we're in the room and
Please.
I don't see the raised hands? But wonderful talk, and I loved your slide on the learnings. We're just starting to work with companies on these research projects, and have found it really challenging to be partners and not just work in parallel. And so I wanted your advice, because they have these timelines that are so short, and the research component is like, we like all the processes they're doing, but what we want to do is between, step 2 and step 3, go search the literature or do some other, things to find out important things that we can then feed back to them. But they just want to do it all in a couple of weeks. So how do you approach, we're meeting with the company today, and it's a new grant, and how should I talk to them and about this issue?
Yeah, that's a really good point, and something that we, had to grapple with as well. I think from the beginning, I think when you're trying to work out the scope of work and trying to figure out, how that's going to happen, building time in for those feedback cycles from the community, is really important. And we had actually found, at the beginning, the partner that we had originally for the Footstep project, they wanted to do something similar. They wanted us to come in, they were going to do their work, and then we leave pretty quick. And we talked with them about, how we're wanting to really do this in a partnered way with the community, and we will need to have time to get feedback and bring that back. And then we adjusted the scope of work so that, the time allowed for that to happen. And actually, when we were doing the project, it was the other way. Because when we brought information from the community to the partner, they were not always the best at getting that information, included into app update cycles and giving that back to us. So even if they wanted initially for that process to happen much more quickly and streamlined, in the end, it was really the bandwidth of their company to actually get the changes made on the app that was slowing things down. So I think it's hard at the beginning. I think one major thing that we learned with that company is that we were not talking with the right people at the beginning. We were talking with the leadership. And the leadership were really bought in. They were great, very, very good meetings where they're like, oh, sure, we can do that. Sure, we can do that. And then when we actually started talking with the tech development, we realized that things were going to move slower than we had thought. And there were some things that we couldn't do that we should have asked about at the beginning. So I think really scoping out that the scope of work to build in the time for feedback. But yeah, also just clarifying what is going to be possible, at the end.
Thank you.
Yeah, it's not easy. Definitely, it's every relationship that you're beginning with a company is different, just like any relationship, and so you really have to try to figure them out, and they're trying to figure you out too.
Heather, I've got a particular interest in the Keep Calm app. I have a very autistic nephew. Oh. He's going to an autistic school. And I wondered how well, I've got 3 questions. I wonder how well the devices were tolerated with the children actually wearing those, because I think my Marshall would probably not go for it, but that's sort of one question. And was there an individual push for alert for each individual student if they were going off the scale? So would the teacher actually be getting, ping, 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 going off in the classroom? And then what is your rollout plan for that? Because I think it sounds brilliant.
Well, thank you. So I'll answer the first question first. So with the wearables, actually in the study that we did through the Children's Hospital of Philadelphia, where we looked at wearables just at the beginning, which wearables will they use, which is going to be comfortable. We found that with the 2 devices that we ended up using, 85% of the kids would wear either one of those for at least a few hours. So 15% of kids were just never going to wear it, and that's totally fine. And kids with autism often have sensory sensitivities, or they don't necessarily like things on their body. My brother never wanted to wear a watch. We want to hold the watch but not wear the watch. But he would be fine with a chest strap because he likes that kind of feeling of constriction a little bit. So really working with the child to figure out if it's, and the parent and the teacher to figure out if it's a good fit or not. It's not going to be a good fit for every child. We've developed some tools to help children who might be comfortable but need a little bit of help to kind of get used to wearing a device like that. So we developed some social stories where we show, we wear devices, we call them gadgets in that social story to kind of get them more familiar. And we basically do like desensitization. So we wear it for 15 minutes one day, take it off. Next day, let's try to do it a little bit more and see if it works. And if it doesn't work, that's fine. And if they do not have that, they can still use other parts of the app. They can still track behaviors and take note on triggers and strategies. It's still going to give alerts about which strategies are best. It's just not going to be based on the physiological stress reduction data. But the rest of the app will function that way. So with the alerts, so at the moment, we are testing it in more of a controlled setting. So we are bringing teachers on for the rapid cycle prototyping just with 1 student. For the randomized control trial, we are planning to bring on a teacher and at least 2 students. They might have more, but at least 2. So we'll be able to see that then. I think we've been really playing around with how can we get the best hit rate in terms of the pop-up notifications for strategies, because you're right, we don't want it to be like pinging off all the time and that being very distracting for the teachers. A few different ideas we've tweaked and well, originally we did look at the thresholds, and we made some adjustment to the algorithms as to if you go into the orange zone or the red zone, it's not, if you go into the zone, it's not going to give you another alert if you're still in the zone within 30 seconds. Like we tweak some things like that to make sure that they're not getting overrun with all these different notifications. And yeah, we tried to make it make it so that it's not going to not give enough information, but also not give too much. And so we're trying to strike that balance now. And we're using the data that we get and the feedback that we get from teachers in the rapid cycle prototyping to tweak some of those things. In terms of commercialization, was that the last question? Or
it's just like there are obviously autistic schools all over the world that if you can show that this is a useful and low cost option, I'm sure that there would be huge take up.
Yeah, low cost is really something we had in mind. So with the devices, they're about $50 per device. We wanted to have something that's really low cost. So all the devices that we tested at the beginning were at a low price point. We actually published some data on that. And definitely we want to make the app widely available for a limited cost. Of course, there will be some costs involved with maintenance of the platform and everything that we'll have to fund, but we definitely want to make that accessible. We don't have a clear commercialization plan in mind right now, but that's definitely something I want to think through more. If we show in the randomized control trial that we're about to do that it helps to manage behaviors like we think it will, that teachers find it feasible, acceptable, appropriate, to use in the community in school settings, then I think the next step is for us to do a large scale randomized control trial, and then following that, and getting that out to the market. I know that could be a few years away from now, and I hear you. I want it to be in schools earlier than that, but I think there's value in doing things like one step at a time.
It's certainly very exciting.
Thank you. Yes, I've put my heart and soul into that project.
May I ask a question? Yeah.
Sure.
First, introduce yourself too.
Yes, sure. My name is Bruna. I am a PhD student here at CIS department. I am completing my second year, and I really love your presentation. All the parts, mainly the parts that you share, the knowledge that you gain through each one of the projects, working with a broad aspect of stakeholders. That's so interesting to makes us think about how should be our approach with different stakeholders as well. But out of curiosity, I don't know if I misunderstand something. I'm sorry if I did, but about the Keep app, the first one, the Calm, you mentioned that each individual has some specificities and the app will learn the best strategies. Is there any computational approach behind this learn the best strategies? What is it?
Sure. Well, we thought a lot about that, and it's definitely something that we're still tweaking. But the basic computational approach right now is that the suggestion is based on 4 data points. So it's based on the physiological stress, the magnitude of the physiological stress reduction within a certain time period. I forget what it is. It's something like 5 minutes after a strategy has been implemented. This is all based on timely data being entered. So that's something that we're really working with teachers to make sure that they're doing. They're not always able to take data in the moment, but if they take data a few, 10, 15 minutes later, that they try to timestamp to as close as possible. So it's based on that first data point. The second data point is the latency at which they return to baseline from in their heart rate. So every child will have a different baseline heart rate. We have them first calibrate the app using that, and then they can see how they are increasing based on that relative point. So we, as soon as they, we measure the latency to get back to the baseline. The next point that the pop-ups are related to is whether they subjectively say that the strategy worked or not, so they can give a thumbs up or thumbs down to a strategy. So it's based on that, and also any behaviors that happen after the strategy has been implemented, which would mean that the strategy wasn't really effective. So those 4 things right now, they're being weighted equally. We are planning on tweaking those based on some data that we get from the rapid cycle prototyping, but the general, and we want to do some validation of that algorithm, but basically that's the approach that we're taking now.
Okay, thank you.
Right.
It's a great question.
Yeah, please.
Look, the standout for me was the Keep Calm app. I'm fascinated by the real-time kind of data, alert, action kind of, scenario with it. I'm just interested too in the practicalities where a teacher is in charge of a class, and I think it was touched on just before, but getting interrupted, I suppose, in the sense of, getting an alert and then trying to act on that. I think you said there's some trials happening in schools, and I'm just wondering if that's been an impact and whether they had learning support officers or teachers' aides to kind of deal with implementing the strategy so that the class aspect of things can still continue for the remainder of the students.
Right, that's a really good point, and something that definitely has come up in our interviews and now in doing the testing. We are wanting to involve everybody that's on the child's team in the app. So definitely their teacher, if they have a one-to-one aide, a behavioral support worker, if they have, sometimes they might be pulled out for speech therapy or occupational therapy, anyone who's on the child's team, we want to have involved in the apps. And right now we don't have the server working, so the data can't sync, but on our next testing cycle, we'll have that ready. And so the app will sync in real time, so they'll be able to see the data coming in. Only the person who is connected and is closest with the child in terms of physical distance will be able to see the real-time stress alerts, but the rest of the data will be available to the rest of the team. So we're thinking that the teacher, given that they have the rest of the classroom to manage, will probably not be the one that's going to be taking the majority of the data. It would be more the one-to-one aides. Many of the children that we work with have one-to-one aides for their behavior. Or many classrooms also have like an overall classroom aide who can help with taking that data. But the idea is that anyone on the team can note, whether a behavior happened, a strategy happened, or a trigger happened for a child. And whoever is connected with the devices will be able to also get those alerts. So that's, yeah, it's a really good point, and something that has come up a lot in terms of feasibility and thinking that through with the teams.
I assume the bracelets and chest straps, they connect via Bluetooth?
That's right. Yeah, they connect via low energy Bluetooth. And
any issues with dropout, and who then would go and fix that if it, if you had to reconnect?
We in our testing of the Penn devices that we chose at the Children's Hospital, we did have some issues with some of the devices for dropout. We looked at reliability in a couple of different ways. We looked at sampling fidelity, like if you're testing for 10 minutes, do you have 10 minutes of R/R millisecond data? So just checking sort of basic stats on that. We also looked to see if there's issues with dropout in terms of beats per minute or R/R intervals, if there would be any basically artifacts or outliers. And the 2 devices that we chose were ones that met our quality thresholds for those two metrics. So we haven't actually had any issues. We are having issues with our accelerometer. So I'm trying to look through different options for that. I didn't mention this in the talk, but we also want to measure movement over time, because of course, if you're running around, your heart rate's going to go up, but it's got nothing to do with your stress levels. You're just physically active. And so the app has a way to know that if you have an accelerometer also connected. But the accelerometers that we are testing right now do not work very well. And so we're trying to problem solve that and look at different options.
Thank you.